Recently, Guyanese-born infectious disease specialist Dr. Moti Ramgopal has been making headlines as one of the lead investigators in the coronavirus clinical trial cocktail used to treat President of the United States, Donald Trump. Dr. Ramgopal of Midway Research Center, based in Fort Pierce, Florida, is part of the clinical trial for a Regeneron-CoV-2 antibody cocktail, which has shown to reduce viral levels of the coronavirus and lead to improvements in symptoms.
Being chosen to be on the one of the investigators in the clinical trial, I'm sure it came as no surprise. So how did this happen? How were you chosen?
Here is a virus breaking out of a place called Wuhan, China. And then I started to say, what is it we can do in our clinical site in Florida? And by March, we started seeing patients. Here was remdesivir, which was used for Ebola viral treatment and wasn't successful. So I called my friends at Gilead and said, look, I've been in clinical trials for a long time. Can I get usage of remdesivir in my hospitals? And at that time, we were only one of two hospitals in Florida who was given access to remdesivir very, very early. And from the remdesivir story, then I get recalls from a lot of different pharma companies. And then Regeneron, reached out to us and said, we have a molecule that has antibodies against the coronavirus in two different ways. Are you interested in these clinical trials? I said, yes, I'm very interested. Let's get it started. So, there are many other sites that they picked around the country, but there's not more than I think there were 70 or 80 sites around the country. But we were very involved into the study from very, very early.
So can you explain the cocktail? What was it exactly? As you said, you've got the molecules to work on.
So great question. So when you look at cocktails start in the era of HIV. Cocktail was a combination of 2 or 3 different medications that will work at different sites of treatment strategies. So when we developed cocktails against HIV, it was against certain receptors or against the nucleoside reverse transcriptase or integrase, and we tend to use 2 or 3 different treatment strategies. So the cocktail we were working on with Regeneron, actually what the president received was first he received remdesivir, which is a drug that works against the virus. So it's purely antiviral. It stops the virus from replicating. And then we moved to the other part of the cocktail, which was the antibodies against the virus, against the viral proteins. So what was the viral proteins? There was the attachment of the capsule of the coronavirus, and also I'll call it spike protein, which is a specific protein that attaches to the pulmonary lungs. So this is where the Regeneron medication worked on 2 different sides. Remdesivir works on the virus itself to stop the replication. The other drug, which is Regeneron-CoV-2, that's the name we call it. It will get its own name now. So actually, it's a medic. So on one hand, you're giving a medication that kills the virus, stops the virus, and then on the other hand, you're giving an antibody, which is what we should normally produce against a bacteria or virus, against the virus.
Midway Research Center, with Dr. Ramgopal as the principal investigator in clinical trials, has so far been recognized by name in 36 published studies on extensive research into HIV and hepatitis C infections. But how did it all begin for this son of Guyana's soil who grew up in Kitty, Georgetown?
When I finished high school in Guyana and in the early 80s, and this was a very difficult time. We had no hope of even leaving the country to do medicine without a scholarship. And I even applied to do law at the University of Guyana. And here I was, the door opened up for me to do medicine in Jamaica. So I went and 5 years of medical school. Then I went to the Bahamas. And in the early 90s in the Bahamas, you're seeing so many people dying from HIV. And then you go into the patient's room and you look at their chest x-ray. Here's tuberculosis. Here is cryptococcal meningitis. What is cryptococcal meningitis? So all of these things were fascinating to me. And very early, I began to recognize that you can actually treat someone with infectious disease and they can completely recover. I started my private practice actually in a very small town. And I introduced the concept of clinical trials and clinical research. And that's when I go to the hospital on a daily basis. I have a clinical research center, which I've done over 200, 300 clinical trials that involves every single medication in HIV today. I was involved in the cure for hepatitis C. That was 5-6 years ago now. We have a bunch of treatment strategies in that pathway. I'm also working on multiple clinical trials for the cure for HIV, and that will be fascinating. In retrospect, I look back at it as was my destiny. If this was charted for me, and no matter what course I would have taken, this had to be my life.
Scientists believe the coronavirus made its first jump to humans in Wuhan, China, sometime in mid-November last year. Chinese officials said the virus arose from a local live fish and animal market.
There's a theory that it came from the bats, and the bat somehow it mutated, and they went to the pangolin, and then to the fish, and this whole theory. Do you believe in that theory?
Well, the coronaviruses are natural. The bats are natural reservoirs. So every animal, they have reservoirs of viruses. Like HIV is a natural reservoir for monkeys. So so when we look at the bat now, the coronavirus is just a natural reservoir. So how does now you put in 2 or 3 different strains of viruses together, and this is what can happen. And I've seen this with the influenza virus, with the swine flu, the avian flu, and they combine, and then you get H1N1, H2N3, H5, and so the different strains of these viruses tend to, when they get together, it allows them to genetically mutate. So that's probably what happened from the bat to the penguin. So that's probably the right environment was there for that virus to mutate, to become SARS-2. Just what we're seeing today, this coronavirus 2 is really a very exploding sort of a virus, which we've never imagined and never saw. We conceptualized this years ago that this can happen, but we didn't think we were really going to see this in our lifetime.
So based on that last point you made there, do you believe, in your opinion, that this virus evolved, or was it man-made?
So most times when you look at viruses, a lot of it are evolution of viruses. And I know there's going to be that long debate. Is it man-made? Does it evolve? Most of us would like to believe it evolved. We'd hate to believe it's man-made. If it's man-made, it's a horrible man-made virus to let loose in society and the world today. So as a scientist in the scientific world, we will still believe that it evolved at the present time until we have further evidence to assume otherwise.
How long does viral evolution take?
SARS-1. The question was, how long is it going to take for SARS-1 to develop with SARS-2? And most people predicted 20 to 30 years at least. So when we look at this is 10 years, 12 years later, this is probably a faster evolution than we expected. Sometimes viral evolution takes thousands of years, easily, tens of hundreds of years. And now here we're seeing a viral evolution in 10, 12 years. I think that's a brilliant question you just asked. I mean, how does this evolution happen? It's all dependent on this structure. Here is a bat, here's a penguin, and there we go. So without those pieces in place, it wouldn't have happened. But because we allow those meat market to continue, and we've known these meat markets were challenges for years. We've known, and you look back historically, out of China for the last 2,000 years, there's lots of pandemics have evolved out of China in this period of time, and this meat market story should have probably been addressed by WHO earlier. It should have been looked at. Did we miss something here in the world that we should have been much more aggressive 10, 20 years ago, and we waited for this to happen?
Initially, it left the world in shock with too much unknown. Now, what have we learned about the virus?
I must say this because I want to put this on record that I've been preparing for quite a bit for an interview such as this to explain really to our viewers the coronavirus, because this is a new virus, and since it began, there have been several, misinformation, myths, false news being spread, and we know that false news also spreads like wildfire. So basically, I wanted to bring to our viewers an in-depth understanding of really what the coronavirus is. So I'm very happy, I'm delighted, and I'm so elated that it is you that has granted me this interview today. The virus itself, the characteristics of the virus, what's the size of it? We want to talk a bit more about that because it's not very much known.
So the size is incredibly small. You can't see it with the naked eye, of course. It's smaller than anything you can see. You need electron microscopy to really see the virus. So it's in the part of micro millimeters of the size of it. Very, very incredibly small. But when you look at the name of it, it's coronavirus, means like the head of a crown. And the coronavirus family has been around a long time. It's an RNA virus, meaning that the genetic code of this virus in a single-stranded form. There are DNA viruses and there are RNA virus. So the corona is an RNA virus. It's what we call a novel virus, meaning that we've never seen this strain before. So here we go, and remember, let's rewind back January, February, March. All we hear is numbers of cases are rising. We really didn't wash your hands, make sure the contacts are clean, make sure you wipe the tables. The virus lives on surfaces. The virus may live in air, we don't know. But it's very clear what happened very early, that this virus mutated. It mutated from an earlier, less contagious virus to a more contagious virus. We now see that there's 6 different mutations. And what does mutation means is that as the virus mutates, it gains, it develops new strategies to spread and to infect people. So here now it becomes aerosolized. It stays in the air longer. You sneeze, it stays in the air it just doesn't drop. It stays in and then if it picked up in a gust of wind or something, it can spread. So now from aerosolized, it becomes airborne. And that's the story of the coronavirus, which we have taken such a long time to accept.
When the virus particles enters a person's nose or mouth, it floats in the airway until it brushes against a lung cell. The virus binds to that cell, slips inside, and uses the cell's machinery to help make copies of itself. They break out, leaving the cell for dead, and penetrate other cells.
So coming back to the virus itself, when it enters the body and it hijacks the cell, the research shows that it prevents our immune system from actually responding. Explain what happens when that process is happening in the body, when the coronavirus enters your body.
So when it enters, because again, we have never seen this virus before, so the body is now saying, this is a new virus, I need to start developing antibodies. But we take a long time to develop antibodies. It takes at least 2 to 3 weeks or even 7 to 10 days to start making these antibodies to effective levels. So now that the body's never seen this, we have no memory cells to say, hey, I recognize this virus. Let's mount the immune system. So now the body has to start from scratch, start new antibodies, and then it just derails the immune system by saying, I'm going to trigger, so the spike protein, the other proteins of the virus, it triggers new pathways. It not necessarily fools the body, just tells the body, this is how you must respond. And it responds in such a hyperimmune way that the inflammation is so high.
After a few days, the virus replicates, creating millions of copies, and can now spread and infect another human being.
So for example, coronavirus, you're exposed today. By 5 days, you start having symptoms. But the 4th day is probably when you start transmitting the virus to a lot of people. That's why we tend to wear the mask, to prevent that transmission. But by day 5 is when you may cough, you may express the virus. This is when the virus is truly replicating, day 4, day 5, day 6, day 7. After that time, the virus now has this protein that stimulates the immune system to become very overactive. That's why patients become short of breath. They got inflammation in the lungs. You look at their chest X-ray, you see what looks like a viral pneumonia, and then patients' oxygen starts to drop. And that's why we have to put them in the hospital, start on oxygen, and start on different treatment strategies.
The virus is now disrupting the normal functioning of the body's organs and begins to cause complications.
So this virus now not only goes into the lungs, it goes in throughout your body. It goes into your GI tract. Some people may have diarrhea, GI symptoms. Not only that, it also triggers the immune system to clot, whereby you have small blood clots in your nostrils, you can't smell, multiple clots in your lungs, multiple clots in your legs and your body. It can affect your heart, it can cause myocarditis, can cause cardiac damage, affect your lungs severely where you cannot oxygenate your lungs. We have multiple clots, what we call pulmonary embolus in our lungs, and that can shut off our lungs completely from oxygenation. And we can have clots throughout our body.
The United States recently surpassed more than 9 million coronavirus cases. So far, more than 229,000 people in the United States have died from the virus. Dr. Ramgopal believes that the attributable deaths to coronavirus in the coming months will be much higher than estimated.
I heard on the news that by February, we should have like about 400,000 people might die from coronavirus.
Yes, because if you look at the recent numbers around the country, where it's 70,000 and 80,000 new cases, and you're looking at the elderly population, and you're looking at younger groups of people, those numbers will really keep climbing. When we look back at the 1918 flu, where about 600,000 people died, I think we can pass those numbers heading into next year. I think the numbers may even be underestimated. Someone asked me today if I think the numbers are real, and I told them I think the numbers are underestimated at this time. There are many people who die and we don't even check them for coronavirus, and we just said they died from cardiac disease or something else. So the question of the number of 200 something thousand we're seeing now will be much higher. The 80,000 people who are infected now that tested positive, it may be twice as much.
So with the vaccine, what are some of the major side effects you think would happen with the vaccine?
So one of the fears we have, it may not work, or if it works, it may not work for long periods of time. As we've seen with the influenza vaccine, that you have to get a shot every year, only 30% of the time or 40% of the time, the circulating virus is actually, the vaccine will trigger those antibodies that will work against the circulating virus. So one, the effectiveness will be challenged. Two, the sustained effectiveness over a period of time. If I was to give a vaccine to 1,000 people, is it really going to work? And if it's going to work, how long is it going to work? And then we have the challenges of side effect of vaccines. What does that look like? Fever, body ache. Sometimes patients complain that receiving the flu shot is worse than even getting the flu. Sometimes you hear that story. Allergies to the components of the virus. People can have transverse myelitis, whereby they have this inflammation in their spine and get weakness in their legs. Some people can get encephalitis, whereby the brain becomes inflamed. Some people can get seizures from it. There's a lot of, over the years, vaccine development has not been easy. We look now, we're 35 years in the HIV epidemic, and we still don't even have a vaccine for HIV, and there's still far away because of the constant mutations of the virus as well. So even if we do get a vaccine, is the virus going to mutate away from the vaccine we develop? And is this complication of the vaccine a question? So it's important to develop vaccines very safely. It's important to develop vaccines that are very effective and have a greater understanding of the story. And the thing with vaccine studies, when you look at it, it takes 2 to 3 years. You don't crush this in 6 months and say, here's a vaccine and try it. Let's see if it works. Like how they're doing it in Russia or in China, or they're saying, let's just try the vaccine right away. No. I think we got to be patient. We got to understand that this virus is not going to go anywhere in a hurry. And we need to still have the control mechanisms we're talking about, like masks and everything else. But vaccines are very important in the long term.
So if this virus continues to mutate, what's going to happen when you develop a vaccine? How is it going to work? It's like, you're putting one step forward and another step backward.
Well, it depends. So hopefully, even if the virus mutates, the basic components of the virus, meaning the spike protein, the surface proteins that we're going to develop as antibodies against, should still be relative. Should still be relevant. When you look at the mutation may not be that significant. I mean, if you look at the last 4 or 5 years, it's not that major mutations, it's minor mutations. So, but if now the virus mutates into a more virulent strain, that could be incredibly dangerous and serious. So that's also the concern. Here we had SARS-1 mutated. We have now SARS-2. The question is there going to be a SARS-3 or is there going to be a different virus?
And the question of herd immunity comes into play. This has been an ongoing discussion in the American media, where talks about a large portion of the community, known as the herd, becomes immune to the virus, making the spread of the disease from person to person unlikely.
I've heard a lot of talk about herd immunity. Can you explain what that is, and will we have herd immunity before we have a vaccine?
So the herd immunity question, I think we've never had any virus that we've ever developed herd immunity to that has stopped it. I believe there's always going to be some amount of herd immunity with any virus. So like, for example, you go in a room and everyone has a flu shot and they're all exposed to low levels of flu and you're exposed to low level of flu. You can now develop you'll develop immunity against it, and that immunity can spread from people to people. So everybody gets this immunity against the virus. But I think this virus is killing about 3 to 5% of people. 20% of people really getting sick. Do you really want to develop herd immunity to a virus like this? I think the questions we truly have to ask ourselves is, to develop herd immunity, you're probably going to have a few million people are going to die. Do you want to put the country at risk or a population at risk to develop herd immunity? Have we ever shown that herd immunity actually ever worked in viral control ever? I don't think we haven't. So So the question is herd immunity. I think it's something we shouldn't be discussing at this time. We should consistently push ahead with wearing masks. And mask, in my opinion, as Dr. Redfield said, and completely agree with him, is as good as a vaccine. If you wear your mask around somebody and they're wearing a mask and you have COVID and they don't, if you do cough, it stays within the area, it doesn't travel to 6 to 8 feet, you're protected as well. So I do believe that the mask is even better than herd immunity. Why do I need herd immunity when I can wear a mask? And why should 5% of people die to develop herd immunity, or even more people get sick?
When it comes to the devastation that this coronavirus would have caused and will cause in the future to come, okay, let's look at people in lockdown. They're eating unhealthy, they're not exercising, developing other complications. Even if they would have survived having the coronavirus, they probably would have left, with, reduced lung function and so forth. What are the other complications as a result of this coronavirus that we would have to endure with in time to come?
This is going to be a huge challenge in the next 6 months or a year, where we are seeing patients who put back their healthcare needs to the different level, and now they're presented much sicker and much more difficult to treat. So that's one story. The second story, as you mentioned, the mental health story. We begin to see a lot of people with depression, a lot of people with social anxiety, panic attacks. I mean, many times I go home after seeing 10, 20, 30 patients, 40 patients in the hospital, and I personally sometimes have anxiety. What if it was me next? What if I get short of breath and I can't breathe? What if it's my mother who's 82 years old? So there's a huge issue there going on. People can't go on vacation, people haven't been traveling. But I think when you look back at the history of the world and you rewind back to the Second World War, rewind back to the First World War, the question is, it really challenges society. And I remember, having that debate to myself about 6-8 months ago when I was driving to work. I said, something has to recalibrate. And the question is this our recalibration time? It is something telling us that we have lost a lot of value, our belief in religion, our belief in culture, belief in each other is lost. The whole society is lost in certain ways. So this is probably going to be a recalibration. We're seeing people who did a lot of, collateral damage, as we call it, with depression and social anxiety. There may be social violence. Like in February, March, I was having this discussion with my brother, and we said, probably in the next several months, we'll see a lot of people taken to the streets and a lot of challenges we're facing. So when we look at all the street protests, we keep thinking, it's because of this. But it could easily be because of the coronavirus. The COVID pushed people to behave differently today. And we've seen this all over the world. So the entire world is undergoing a huge political upheaval, emotional upheaval, and different challenges that we'll be facing much more in the next 6 months or the next 2 years.
With a special report for the Guyanese Diaspora News, I'm Jennifer Jabbar.